According to the Center for Disease Control and Prevention, 3,700 infants fall victim to sudden infant death syndrome within the first year of life in our country every year. This tragedy can touch any of us, whether you know somebody that has an infant or a close friend. We are all susceptible to being affected by this issue. My own personal experience being a new mom, I remember lying awake at night wondering, am I doing this right, am I doing this wrong? And after doing my own Google research late at night on my phone, I found that there are multiple causes and risk factors that contribute to sudden infant death syndrome. The astonishing statistic of infant mortality attributed to sudden unexpected infant death, namely due to the improper education and risk factors can be eliminated by implementing educational policies throughout healthcare providers, not only for new parents, but anybody that's going to be caring for the infant. So we'll first discuss what is sudden unexpected infant death and why does it continue to be one of the leading factors of infant mortality. There are three types of sudden unexpected infant death, one being SIDS. I didn't realize there was a difference between the two. SIDS is sudden infant death syndrome. This is determined as a cause of death when there are three investigations done, an autopsy, the evaluation of the death scene, as well as the health review of the infant. When all these investigations are completed and there is no determination of death, it is considered a SIDS case. If one or more of these three investigations are unable to be completed, it's considered an unknown cause of death. And the last type is accidental suffocation and strangulation in the bed. 90% of SIDS cases occur within the first 6 months of life, according to the Texas A&M Agri-Life Extension Services. The National Institute of Health created the initiative for the Back to Sleep program, which educated health providers, to let new parents know that they should be placing their babies to sleep on their back until they're able not to turn over on their own. This led to the decline in 50% of SIDS cases in our country back in the 1990s. It eventually plateaued to where now in the more recent years it can increase in some years depending. The American Academy of Pediatrics believes that lowering these risk factors, the continued research into what the risk factors are, and educating healthcare providers and parents on them can lead to the full elimination of SIDS as a cause of death. Although there is no exact cause of sudden unexpected infant death, we can discuss the risk factors that increase that risk. The American Academy of Pediatrics believes that creating an unsafe sleep environment can really increase the risk, as well as mothers that smoke, use illicit drugs, and consume alcohol during and after pregnancy heighten the risk as well. And uneducated parents, healthcare providers, and child care providers largely contribute to the possibility of SIDS. Addressing these risk factors accordingly can lead to the decline in the number of sudden SUID cases seen in our country, and implementing the safe practices can also decline the cases seen. This includes room sharing, which means the baby is in the room with the parent for the first 6 months to a year. They do discourage bed sharing. That can lead to what they call overlay, when the parent or caregiver falls asleep and rolls over onto the baby, leading to suffocation. So they really just encourage that they have their own sleep space within the room with the parent, as well as sleeping on their back and making sure that they're sleeping on a firm surface, and avoiding any excess bedding items in the crib. So how do we educate our new parents and health providers on these health risks? The American Academy of Pediatrics published a statement called the Organizational Principles to Guide and Define the Child's Health Care Systems and/or Improve the Child's Health Care Overall. This discusses the topics that health care providers should be covering with new parents, whether it's in prenatal care and at the hospital. There's also a company called the Baby Box Company This company was brought over from, modeled by the government-funded program in Finland, where they provide new parents with a box to place their babies in. It's creating a safe space for them. The box itself, as well as any other resources and educational resources, are provided with no charge. The only requirement is to view the educational videos. So the Baby Box Companies was started here in the United States more recently, only in 3 states right now, Ohio, Alabama, and New Jersey. So implementing these educational policies, lowering the factors, and providing resources can continue to decline the infant mortality rate, and we can take part in that change by doing what we can here to hopefully bring the Baby Box program locally to our state, our city, our state, and then hopefully throughout our nation that can help bring down that mortality rate. The main thing for the Baby Box is that they aren't so concerned with parents using the box as much as they just want to be educating the parents. That's their main purpose. So following the Baby Box founders and committing to ensuring that every parent, every baby is given the highest quality of education and resources can lead to the decline in SIDS cases seen. So I would hope that we can all live by their motto, which is every child matters and every family matters. Thank you.
Very good.